In their review report, the authors said that the effect of myomectomy on fertility is like this. Myomectomy, when done for submucosal fibroids, there was a significant difference in clinical pregnancy rates. And most of the pregnancies happened, that is 75 to 80% of them, happened in the first year after myomectomy. And myomectomy, when done for intramural fibroids, they noticed no significant difference in the pregnancy rates. And another author, that is Arnold et al., in his publication said that pregnancy rates post-myomectomy are like this. So when myomectomy was done for a woman of more than 35 years and with other associated causes, the pregnancy rates were very low. And more fibroids removed, low pregnancy rates. And then posterior wall fibroid myomectomy, low pregnancy rates. And removal of fibroids of more than 8 centimeters had better pregnancy rates. And removal of fibroids distorting the cavity also had better pregnancy rates. This is a graph about percentage of pregnancies in the first 24 months after myomectomy in relation to the age of the woman. As you can see here, end of 12 months, that is 1 year, when a woman is less than 30 years age, the pregnancy rates were between 70 to 80%. Whereas in case of women of 35 years, end of 1 month post myomectomy, the pregnancy rates are still at 30%. With this backdrop of information, I would like to share with you 2 of cases which are dealt at our center. The first case is a woman of 33 years age with 5 years marital life, came to us with infertility. After initial evaluation, she is diagnosed to have multiple fibroids. As the fibroids were away from the endometrial cavity, and she had other associated factors like anovulation, high BMI, and borderline male factor, we deferred doing myomectomy for her. We advised her to lose some weight and come back for the treatment. And fortunately, she conceived spontaneously after losing significant weight. But unfortunately, she lost her pregnancy at 9 weeks. We advised her to come back for follow-up after 6 weeks to evaluate the cavity and the size of the fibroids thoroughly. This second case is about a young woman of 2 years marital life, came to us with infertility. After initial evaluation, she was diagnosed to have a significantly large posterior wall intramural fibroid. As the fibroid was away from the endometrial cavity, and as the woman also had anovulation, we corrected it with the ovulation induction medication. Luckily, she conceived in the 2nd cycle. And this is the pregnancy picture. Though a chunk of placenta was seen implanted on the fibroid, her antenatal, intrapartum, and postpartum periods were uneventful, and she delivered vaginally at term a 2.6 kg female child. To conclude, submucous fibroids have poor reproductive outcome, and myomectomy is beneficial in these cases. Intramural fibroids may have an effect, but the reports are inconclusive. No data yet to support myomectomy to improve fertility, and submucosal fibroids have no effect on fertility. As most of the studies done till date they are poorly designed and have methodological flaws, the future focus should be on intramural fibroids with an emphasis on performance of high-quality studies to assess their size, number, and evaluate the cavity accurately. Intramural fibroids need clarity, evolve, improve, and innovate. And I end my talk with salutations to the great surgeon, Dr. Victor Bonney, and his statement, "Since cure without deformity or loss of function must ever be surgery's highest ideal, the general proposition that myomectomy is greater surgical achievement is incontestable." Thank you.